Good morning, Miss Jane Doe. My name is Adrienne Lee, and I will be advising you today in regards to the facial sore you have presented here today in the clinic. It appears as though you are experiencing some type of skin cancer. As of right now, I'm not sure which type of skin cancer that is because we have not received our results back from the lab today. But I will go ahead and let you know about each type of skin cancer briefly, and then we'll go more in detail about the ones that I believe you may be suffering from right now or exposed to right now. This will allow you to be aware of everything that's kind of going on, just so you're in the know rather than kind of not in the know. There are two types that I think you might have of skin cancer you might have, and that is basal cell carcinoma as well as squamous cell carcinoma. And basal cell carcinoma is actually a growth or a lesion that resembles an open sore. And so those who are actually exposed to BCC, we call this BCC, basal cell carcinoma, are also more inclined to have squamous cell carcinoma, which is SCC. And this also looks like an open sore, and this can be a wart, an open sore, a lesion, or a red patch, or an elevated growth with a central depression. And so some of these can bleed, and the reason that I think that you might have one of these is because the others don't really match up with the symptoms that you have right now. Other types of skin cancer are actinic keratosis, and that is really just an unobserved abnormal growth of some kind. It usually has a scaly or crusty texture, and that's not what you're presenting today. Another type is dysplastic nevi, or nevi, and that is just a benign mole which resembles melanoma, and melanoma is one of the more dangerous types of skin cancer. That is usually a mole or a patch that is kind of various sorts of colors. It could be pink, red, purple, and it might bleed. Or if you touch it or hit it really lightly, or of any type of pressure, it might actually bruise. And you can get that from whether it's genetic predisposition, specifically for melanoma, or all types of skin cancer are derived from just really advanced exposure to sunlight. So that's one way you could do that. Other ways you can get skin cancer are tanning and tanning beds. Those that are UV light, those are really bad for you. So that could cause, the skin cancer you're experiencing right now. Things that I would look for if you are trying to examine your body, which I do actually recommend that you do that annually, whether it be you and or the doctor. I do recommend that you examine your skin once a year at least. If you're going to be outside more frequently than you usually are, then I would suggest that you actually, maybe schedule a random exam, or one that is kind of following a few weeks after you've been outside more than usual. You can do one yourself, or you can have a doctor do it. And what I would look for is any of the symptoms that follow up with any of the skin cancers we've talked about. BCC and SCC, open lesions, kind of like the one that we're observing today with what you presented in the clinic. Active keratinosis could be, a scaly or crusty patch of skin. Any moles, whether they be, just firm or non-colored, those can be dangerous too, so I would get those checked out. Any moles that are of any rare color, or if you have a mole that, or a patch that is kind of, just abnormal, I would just get it checked out. It's always better to be more safe than sorry. So I would be very, very aware of that. So other things you can do to kind of prevent, any further developments of skin cancer could be to wear SPF 15 every day. Sunscreen that is SPF 15 or higher. Or again, if you're going to be outside even longer for an extended period of time, wear SPF 30 or higher. And if you're swimming or if you sweat very heavily, you can apply that every 2 hours. So that would be really good. So as far as your case today, as I said, you could potentially have SCC or BCC. What I would do to treat that is a procedure called the Mohs micrographic procedure. And what that does is it takes a very thin layer of skin off of that area that you have presented to us today. And I'll look at that and observe it under a microscope and assess whether or not I believe there's some cancerous cells there, and that will be mapped out with the frozen skin that I'm looking at under the microscope. And with that, I'll be able to come back and peel another layer off and just repeat the process until all the cancerous cells have been non-observed. So once I finally take off a layer and I look under the microscope, and if there's no cancerous scales or a frozen map, then that just shows that the cancer is gone or potentially gone. And so this procedure is generally used for those who have any type of cosmetic issue, and so this helps preserve the healthy skin, and it helps minimize scarring and things like that. So I would definitely recommend that. We're not going to actually schedule anything today because, again, we're waiting for those results from the lab. Again, I do highly, very much recommend that you follow the procedures or any preventative measures that I just mentioned before. And if you have any questions, absolutely just contact me in the office and we'll help you to the best that we can. Do you have any questions today? If you do, just let me know. And if not, yeah, I would just go ahead, go home, make sure you follow those preventative measures, and then I'll follow up with you in a few days when those results get back to the lab, okay? Alrighty.